Hello, I'm Amanda from Defence Health,
And I'm Ashley from Navy Health.
and we'll be guiding you through the healthcare presentation. We're here today to help you get a picture of how the Australian healthcare system works outside the ADF and provide understanding about public and private healthcare. To begin with, let's look at how your healthcare will change once you leave the ADF. As a full-time member of the ADF, Joint Health Command currently manages your healthcare. In the eyes of the government, this is seen as the equivalent of holding gold-tier private health insurance. However, your access to this, along with ADF Family Health Program, will cease on your transition date. So, post-transition, how do you manage your healthcare? DVA will become your primary provider for accepted conditions covered by your white or gold card. But who looks after everything else? And where do you go when you become injured or sick?
Let's break down the public healthcare system into 5 main aspects and paint a picture of what it looks like out there, beginning with what is likely to be your first interaction, a visit to the doctor's office.
Also called general practitioners or GPs, they are your primary healthcare providers for all health concerns and advice. Your medical journey starts with your GP. Whether you need medicine, a referral to a specialist, or admission into hospital, it all starts with your GP. So who pays for your GP consultation? If your GP bulk bills, this means that the doctor's total fee for that service is covered by Medicare. Therefore, there won't be out-of-pocket costs. However, availability of bulk billing GPs are becoming harder to find. Many GPs charge more than what Medicare covers, leaving patients responsible to pay the difference between what Medicare covers and what the doctor charges. This is known as your out-of-pocket cost. Below is an example of how this might look. In each state and even different towns, the cost will vary depending on what the GP charges. It's important to know that private health insurance cannot help with covering this cost.
To access these Medicare benefits, you need to be registered with Medicare and hold a Medicare card. Without it, you won't be entitled to publicly funded hospital care and medical treatment, and you'll be responsible for all treatment costs. To register for a Medicare card, visit the Services Australia website and follow the prompts.
You may find access to community health services within your community. Community programs help to promote health and well-being in the community and include clinics, exercise and preventative health programs. They provide comprehensive primary healthcare services, encourage good health and advice to prevent ill health, help people manage existing health conditions to avoid hospitalisation, and enable people to recover from hospital treatment in the comfort of their homes. Below are some examples of healthcare areas' community programs and how they can assist you.
Your doctor may provide you with the prescription for medication which you take to a pharmacy. Pharmacists specialise in medications and provide pharmaceutical advice and guidance. You cannot purchase prescription medication without a prescription from your GP. However, you can pick up non-prescription medicine here. Pharmacists also offer other services, such as health screenings and immunisations. While the government subsidises some medications, most will have an out-of-pocket cost. You may only need medication to complete your treatment. But should you need further assistance or advice, this is where healthcare specialists and professionals step in.
Healthcare specialists, different from professionals, have advanced education in specific areas of medicine. Why would you need to visit a specialist? Some common examples include seeing a cardiologist for heart conditions, or an orthopaedic specialist for spine and bone issues. If you need to visit a specialist, a referral from your GP is required. While Medicare covers a portion of specialist fees, you are responsible to pay the out-of-pocket costs. If you are ever admitted into hospital with a specialist, private health insurance can potentially cover the remainder, depending on your level of cover. However, we'll talk about private health insurance in more detail later on. Healthcare professionals are your more common healthcare providers you might see, including dentists, optometrists, and podiatrists. They provide medical treatment based on formal training and experience, not necessarily advanced education. This means you don't need a referral for their services. The full fee for these services are typically all out-of-pocket costs, as Medicare does not provide any rebate for these services. If you do decide to take up private health insurance, depending on your level of cover, your private health insurance may help cover part or all of this fee.
A doctor or specialist might suggest hospitalisation as the next step in your healthcare journey. There are 3 ways you can be treated in a hospital. You can be a public patient in a public hospital, a private patient in a public hospital, or a private patient in a private hospital. Let's talk about these in a bit more depth.
All Australians are entitled to receive treatment as a public patient in a public hospital if they are registered with Medicare. The main benefit of attending a public hospital is Medicare covers 100% of the costs. This is also most likely where you will be taken in an emergency. However, there are some disadvantages. The main one is you don't get to choose the doctor or specialist who treats you, or when and where you are treated. Another disadvantage is the timing of your admission is subject to wait lists. Wait lists for public hospitals are determined based on the severity and urgency of each condition. They can vary by state, locality, and even by hospital. This means that you can be waiting for years to receive your procedure if it is pre-planned and not considered critical. Private health insurance covers the option to be treated as a private patient in a public hospital, providing some benefits. This option is available to private health insurance holders because they still contribute through their tax to the Medicare system and therefore are still entitled to be treated by the public system. It's best if you check with your health insurance fund for specific information about this.
The other option is to be treated in a private hospital. Being admitted into a private hospital, you can either self-pay, which can be a bit expensive, or hold hospital cover with a private health insurer. So why attend a private hospital over a public one? When you get admitted into a private hospital, you gain the ability to choose where you're treated and the doctor or specialist who treats you, allowing you more control over your care. You also get to skip the waiting lists that occur in public hospitals and, depending on the availability, enjoy a private room.
Okay, so let's do a check-in. These are the topics we have discussed so far. If you have any questions, feel free to pop them in the chat box.
So far, we have discussed a typical healthcare journey and the costs associated at each step and who's responsible for them. Let's talk a bit more about the role of private health insurance in healthcare and how it can make the costs of healthcare more manageable both in and out of a hospital.
Private health insurance has 2 types of cover: hospital and extras. Hospital cover is the cover you hope you won't have to use. If you're admitted into hospital, it helps pay for the in-hospital related expenses. For example, if you need to undergo a surgery, it will help cover your accommodation, operating theatre fees, and more. Extras cover helps cover healthcare services that Medicare does not subsidise outside of the hospital. These are for services you more commonly use to maintain your health, such as dental, optical, and physio. With extras cover, the higher your premium, the more benefits you get. There are different levels for each that you can choose from. You can get either type of coverage by itself or combine them by mixing and matching the levels to suit you and your family's health needs.
When you first take out private health insurance, you will need to consider waiting periods. These refer to a specific time frame during which benefits cannot be claimed. However, if you choose to take out private health insurance from your transition date, then no waiting periods will be applied to you. However, if you don't take out private health insurance from your transition date, you may have to reserve these waiting periods before you can claim again. For example, for those planning to start a family, the waiting period for pregnancy-related benefits is typically 12 months.
When it comes to hospital cover, it's important to understand that when you visit a private hospital and hold private hospital cover, not always does this mean there will be no out-of-pocket fees. When you choose to be a patient in a private hospital, Medicare will cover 75% of the MBS for that treatment, and private health insurance will cover the extra 25%. In most cases, this covers most of the cost of your treatment. However, in a private hospital, doctors and specialists can charge more than 100% of the MBS fee for their treatments. And in Australia, there's currently no legislation or caps on what doctors and specialists can charge a patient. Any costs above what Medicare and private health insurance contribute are considered out-of-pocket costs and will need to be paid by you. Here's an outline of what private health insurance covers if you are admitted, and an outline of out-of-pocket expenses you may have to pay. It's important to check with your private health insurer to understand your out-of-pocket costs before being admitted.
So, how can you manage your out-of-pocket costs when visiting a private hospital? For most people who have private health insurance, the health fund picks up most of the costs when visiting a hospital. However, gap cover agreements can help minimize these out-of-pocket expenses if you have any. There are 3 types of gap cover agreements that a specialist can choose to participate in. A no-gap agreement, which means that your doctor agrees to charge the MBS price. This means you don't pay any out-of-pocket costs, and the treatment will be covered under your private health insurance policy. Then there is a known gap agreement. This is where your doctor sets an agreed price for the procedure. This means that there is an agreed gap that you are required to pay. This reduces the risk of extra unexpected costs popping up. Then finally, there is a no agreement. This means your specialist or hospital doesn't have an agreement with your health fund to cover the costs of that treatment, and they can charge you at their discretion. To ensure the best cost management, it's important to know which agreements your doctor is willing to participate in, or even feel free to shop around to a few different specialists to find the one that suits you and is willing to participate in an agreement.
When it comes to overseas travel, neither Medicare or private health insurance will cover you. When travelling overseas, consider taking out insurance to cover the costs of an emergency treatment or evacuation. The costs of healthcare overseas compared to Australia can be very expensive, so having peace of mind when travelling is important.
Now that you have a grasp on how private health insurance operates, you might be questioning whether it's necessary. On top of the benefits of private health insurance, the answer lies in understanding the government penalties and incentives associated with private health insurance. To encourage individuals to take out private health insurance, the government has implemented 1 incentive and 2 penalties. These measures aim to alleviate the pressure on the public system and support those most in need of accessible healthcare. The incentives and penalties included are the Australian government rebate, the Medicare levy surcharge, and lifetime health cover loading.
The Australian government rebate is an incentive designed to make private health insurance more affordable. Based on your income and age, the government may make a contribution towards your private health insurance premiums, reducing your overall cost of private health insurance. You can claim the rebate directly to reduce your premiums each pay period, or you can receive it as an offset during tax time.
Then there is the Medicare levy surcharge. All taxpayers are charged the Medicare levy, which is 2% of their annual taxable income. However, high-income earners without hospital cover are subject to an additional tax called the Medicare levy surcharge. If your combined income is more than a certain amount, you will be charged this extra tax at tax time.
Here's an example to show how much that could equate to. If you fall into this tax bracket but take out private hospital cover, then you don't have to pay the additional tax. Again, The government implements this penalty to encourage people to take out health insurance. It's important to know you do not receive any extra benefits if you pay the Medicare levy surcharge.
Lastly, we come to lifetime health cover loading. This one was introduced by the federal government to encourage people to take out private health insurance at a younger age and then maintain it throughout their lifetime. Under this scheme, individuals who get private hospital insurance before turning 31 pay a base premium amount for their private health insurance. However, those who don't hold private hospital insurance past this age accumulate a 2% penalty on their premiums for each year. Then when they do decide to take out private health insurance later in life, they have to pay that extra percent on top of their base price for 10 consecutive years. Thankfully, if you joined the ADF before the age of 30 or have been serving for 10 consecutive years or more, as ADF members, you are currently exempt from this loading. And if you take out private health insurance from your transition date, this won't affect you.
Again, let's do a check-in, as I know this is a lot of information. Does anyone have any questions? And if so, feel free to pop it into the chat box.
So besides avoiding the penalties as we just discussed, what are the benefits of private health insurance? Almost half of Australians have private hospital cover despite having access to Medicare. So why is this? Hospital cover offers several benefits, including skipping the lengthy public system wait times, evading the Medicare levy surcharge and lifetime health cover loading, and perhaps most importantly, granting individuals the freedom to choose their medical specialists, as well as when and where they are treated. There is also other benefits, including ambulance cover. If you value any of these benefits, then private health insurance could be something you may want to consider.
On the other hand, why do over half of Australians invest in extras insurance? Since Medicare doesn't cover out-of-hospital services like dental and optical, individuals often seek extras cover to help manage the cost of out-of-pocket expenses associated with these services. They can quickly become quite costly, so extras cover can help manage your health more affordably.
So now you have a basic understanding of the healthcare system and how private health insurance works and its benefits. What should you really be thinking about now? Deciding if hospital or extras cover suits you requires careful consideration of your life stage, health needs, and financial circumstances. You should reflect on factors such as whether you're young and healthy but want to avoid government penalties, planning for future family needs, or seeking to protect your family. Then assess how private health insurance can suit your lifestyle. It's also important to weigh the costs against the benefits you'll receive to determine a specific level of cover that is right for you. Now, we know this is a lot to think about, and if you have any further questions, feel free to pop them below in the chat box.
If your immediate family already has private health insurance, joining their cover is typically straightforward. However, keep in mind that adding yourself to their policy may affect the premium. You should contact your health insurance provider to obtain a quote for adding yourself to the policy. And once you have your transition date, you can have your provider commence your coverage from that date. Remember, your family isn't locked into their policy, so feel free to explore other options that may better suit your needs. This may include also upgrading the policy to a higher level of cover to address your more advanced needs.
Factors specific to the ADF that should be considered when deciding to take out private health insurance include your DVA benefits. It's important to think about non-liability healthcare and your accepted conditions. If you are or will be a DVA Gold Card member, most services covered by private health insurance will likely be covered by your Gold Card. However, you should ensure that you're happy with the level of cover provided by contacting the DVA. If you haven't received a Gold Card yet, then you might want to consider taking out private health insurance while your card is being finalised in case anything happens in the meantime or your card gets rejected. For White Card members, assess which conditions DVA covers and consider any additional needs you may have beyond that.
In summary, remember these key takeaways from our presentation. All Australians must be registered with Medicare to receive public healthcare benefits. Your doctor is your first point of contact for any illness or injury and will give you a referral if they recommend you see a specialist. There are government incentives and penalties to encourage you to take out private health insurance. Private health insurance can help cover the cost of both hospital-related expenses and non-hospital services. You need to consider what life stage you're currently in and decide if private health insurance suits you and your circumstances. You can add yourself to your family's policy once you have your discharge date. Don't be afraid to switch funds. You are never locked in. If you have further questions, feel free to visit our stands today.
Before you transition, register with Medicare to access the public healthcare system, including GPs. Your doctor is your first point of contact for any illness or injury and will give you a referral if they recommend you see a specialist. They can also assist with care plans for those eligible for these services to help reduce out-of-pocket expenses. Private health insurance can help cover the costs of both hospital-related expenses and non-hospital services. Consider how the government incentives and penalties will affect you and how you can take advantage of them or avoid them. Consider what life stage you're currently in and decide if private health insurance suits you and your circumstances. If your family already has cover, it's easy to add yourself to your family's policy once you have your discharge date. However, don't be afraid to switch funds to find what suits you.
On behalf of Navy Health and Defence Health, we thank you for your time today.
If you have any questions, feel free to put them in the chat box below or come visit us at our online booths today.